I met Michael Docktor a few years ago when I was consulting to Boston Children's Hospital on digital health, and he was a gastroenterologist there and the leader of an innovation team. As a digital native, he was among the many physicians in his generation who just couldn't understand and wouldn't put up with the disconnect between the smooth, high quality experience that he had on his iPhone and the comparative dark ages of hospital IT systems, even those at the top rated pediatric hospital in the country. He co founded Doc Health to help doctors get away from the post it notes and scratch pads and shift to a simple, HIPAA compliant approach to managing daily administrative tasks. In this episode of the HealthBiz podcast, we talk about what it means to grow up with the name Doctor, what he learned as a physician at Boston Children's, and his vision and progress to date at Doc Health. I'm your host, David Williams, president of Health Business Group, and I hope you enjoy the show. At Health Business Group, I lead strategy consulting projects to help healthcare entrepreneurs like Michael develop strategic plans. So if your company needs support, please reach out to me, dwilliams@healthbusinessgroup.com. Mike Docktor, CEO and co-founder of Doc Health. Nice to be with you today.
Thank you for having me.
So we're going to talk about a bunch of stuff about the present and the future, but let's actually rewind to the past and talk a little bit about your background and your upbringing. What was your childhood like? Well, who are your big influences?
Yeah, so let's see. I mean, my last name is Doctor, so you can imagine that there was some implanting done there, and for sure, I think it just had an impact in my life. But I grew up with a family of physicians, dentists, doctors of various sorts. So my grandmother was an ophthalmologist. My dad is a dentist. My uncle is an orthopedic surgeon. So lots of medicine in our lives. And my parents tell me that I used to watch lots of videos of, surgeries and just really enamored with science in early days. I actually have video evidence of saying I want to be a doctor when I grew up at around 5. So
cool.
There's some early evidence of that.
You already were a doctor from that standpoint, I suppose.
Exactly.
But, yeah. So it's good. Actually, it's good that you had those influences in your life. Otherwise, I could imagine maybe you were going to be a dock worker, just given the spelling.
There you go.
But that's pretty good. Okay. And what sort of surgeries did you like to watch? I was just playing like that operation game with the little tweezer.
I was into that for sure.
Yeah.
I don't really remember. My mom tells me that they used to just like live stream surgeries
cool
back in the day, which I don't know how I got access to that, but
yeah,
I apparently was watching that instead of cartoons. And then, all kidding aside, fast forward when I was around 10 years old, my sister got really sick and ended up in the hospital with some GI issues of all things, which is what I turned out to be. But they thought she had Crohn's disease. She ended up being diagnosed with this relatively novel infection called C. difficile, which was novel at the time back in the early 80s. And this, magical gastroenterologist came in from New York City and cured my sister, figured out what it was, cured her of her C. diff. And she followed this gastroenterologist for years to follow. And I would just go with her to those visits. And I didn't know it at the time, but I was being inspired by this, this amazing gastroenterologist that saved my sister's life. And so that, in retrospect, was really, I think, some of the foundational experiences for me that ultimately led me to pediatric GI of all things.
When I speak to people about their careers, often they say, in retrospect, it looks really clear, but at the time I had no idea what I was doing. But I think in your case, you were named doctor. You got doctors all over the place. Your sister was ill. You went to a GI. So to me, it's actually slightly straightforward.
Yeah. It was not as clear as when I was living.
It maybe didn't feel like it. In my case, my father is a highway safety researcher, and we used to bring your kid to the office. So I had these films that I would watch, and they were all these crashes. This is before they had the crash test dummy was a big thing. And my favorite one that I remember was they had these underride bars on trucks where they didn't used to have them, and cars used to come, especially at the time, the VW Rabbit was the small one, and the car would go under and it would get sheared off and taking your head off with you. I guess I should have been maybe a head and neck surgeon, but I was too late for that, so I didn't go down that route. No, that's good. So then early career, so there was a West Coast stint, Children's Hospital out in Los Angeles.
Yeah, so I'm a Jersey guy. I was born and raised in New Jersey. I went to New Jersey Med, and then I had this awesome opportunity out in California. So I actually when I was in college, I shadowed with a endocrinologist at Children's Hospital Los Angeles. I went to camp. She ran a diabetes camp, and that was one of these really wonderful early experiences for me. And Dr. Kaufman was a mentor of mine, and I had a great opportunity and some great experiences at Children's Hospital Los Angeles. So I was able to go there for my residency, and that turned out to just be, not only a great clinical and educational experience, but a great time to experience LA and do the West Coast as an East Coaster. So that was
Yeah,
awesome.
good timing. But then you came back to
And I
Boston.
came back. I mean, I knew, I was married. We didn't have any kids yet, but I knew that I didn't exactly want to raise a family in LA, especially being an East Coaster guy. I like seasons. I like snow.
Yeah.
So we made our way back east, and I had a great opportunity to go to Boston Children's Hospital to do my GI fellowship, which was like a dream come true. So that was a good draw to come back.
Now, I see that you were at Children's for some time, but I don't know if it was always, but more or less from the start, you were doing something other than purely clinical side of things, and I think a little different path maybe than some others.
Yeah, I don't. Again, in retrospect, it's all super clear, but I was always had this entrepreneurial spirit. So I took a year off before medical school and worked for J.P. Morgan. So I had a business mindset, even though I was very interested in clinical care and medicine. I ran an eBay business selling electronics during medical school, and ultimately funded part of medical school through that. So that was a great sort of entrepreneurial thing, which again, that was just what I like to do. It wasn't like I had this destination in mind. And when I was a GI fellow, we spent the second and third of a 3-year fellowship doing mostly research. And I had a lot of downtime in the lab waiting for experiments to cook. And it was around the time that the iPhone and the App Store came online. And I was inspired by apps and thought this was a great way to sort of get your ideas out there. And so I helped with the help of some engineering talented guys that I met through MIT. We built a potty training app. And that was my first experience in building apps, learning about user experience, learning about UI and UX and all this sort of stuff in the earliest days of digital health. This is back in 2010, 2011. And that sort of inspired me and got me on the road to like question why our electronic health record is so clunky and why we don't have iPhones in clinical use in the hospital. And there's a longer story if we have time. Happy to share.
Yeah, well, I mean, so I'm remembering those days, and if you look, a lot of times when hospitals mostly or the government were trying to get physicians to adopt electronic medical records, and the physicians were not necessarily going along with it, and you'd hear this kind of thing like, well, physicians, they're just resistant to technology, they don't want to deal with this, that, and the other. But if you look, when the iPhone came out, physicians, like most physicians, got them right away. And Absolutely. It was a pretty clear gap. You could see what was possible in your own life or when you're doing shopping or browsing or anything versus what you have to do, in the hospital. And I think you were coming along right at that time where you could see that. And I'm just curious, like, how did that manifest itself in the hospital?
I mean, you nailed it. It was just an absolute frustration for me because I was this digital native. I enjoyed, the user experiences of these apps that I was using. I was ordering Starbucks, on my mobile app or getting into an Uber, and you step into the hospital and it's like, a time warp. You're back, 20 years in the past. You've got a pager attached to your hip, which is the most antiquated device like in the history of medicine. And to me, it was just, I was amazed and I started asking these questions. Fortunately, I had access to, the CIO and CMIO at Boston Children's. And I said, like, well, why aren't all the doctors are carrying around their phones? Why don't we have any tools for them? And so the first project that I was sort of handed was bringing in secure messaging into Boston Children's Hospital. So in the early days of secure messaging, which is now, sort of industry standard, I said, well, people are texting insecurely. We should be using, secure text to be communicating instead of using pagers and then have to call back a phone and no one's sitting at that phone anymore because it's been 20 minutes. And so we used a tool called Tiger Text, which is now called Tiger Connect. And that was my first job as, at that time, I was just the mobile mic. I was just the guy that was the clinician that liked to do mobile stuff. And That later turned into being the director of clinical mobile solutions in the program, the clinical informatics program at Boston Children's. So that became a formal role because I was like the energetic youngster who just wanted to like use an iPhone for all the potential and utility that it had in clinical care, and that turned into mobile EHR and then Dragon's Nuance product, or Nuance's Dragon product, excuse me. So, that just really got the wheels turning, and I think ultimately led to a lot of exciting, movement and innovation at Boston Children's.
So you were observing and just being part of it from the physician side. What were you seeing on the patient and family side in terms of, was that same sort of juxtaposition between what the family could do, ordering their Starbucks or their Uber or whatever it may be on the way in, and then getting to the hospital and filling out the 5th generation faxed documents? And
yeah, I mean, there's so much there. My focus was always on the provider because I feel like there was so much focus on the
yeah,
patient experience. And again, I don't mean to belittle the importance of the patient-facing component, but there's so much attention being put on to improving the patient experience. But we learn about the quadruple aim and the sort of provider experience. And to me, it was always this like forgotten element that we didn't spend enough attention at. So of course, the patients, whether it's providing iPads to patients who are hospitalized or improving the patient portal. I mean, there's so much that I was either partially involved with or just energetic and passionate about. But for me, my special area of interest and focus was always on the provider experience, so that we can ultimately make it easier to take good care of patients using the tools that are native to us outside of the hospital.
that makes good sense. I know that as a clinician, though, to be fair to what you were doing, at least taking advantage of some of those things that were out there. I mean, now we know about Zoom consults and so on, but I think at a time where people would have imagined it was like, gee, you're dealing with the GI issues, how can you just do it remotely? I remember at least there was somebody, and children's, of course, draws people from all over the country and the region, and I believe you were doing some remote consultations even before we had a pandemic to force it.
That's just an amazing, we could spend the entire hour on that topic alone,
Yeah.
but I've been practicing, quote unquote, telemedicine for 10 years. And, really it was just a skunkworks project because there wasn't, financial support from the payers for a lot of this. And so to me, it just made sense. Like I primarily take care of children with Crohn's and colitis. And so there's a lot of chronic care management and follow-ups and check-ins. And, it tortured me to imagine that a kid had to miss school, a parent had to miss work, family had to drive in an hour from, Western Mass or longer, and then park and pay for, all that stuff for me to see them for 15 minutes just to check in and make sure that, things are going well. So I tried my best to do virtual care and telemedicine where possible, particularly for the patients that it was just terribly inconvenient or they had some, disability that required like a ambulance transport to the hospital for a 15-minute check-in. That was just always like mind-boggling to me that that's how we did it. And then pandemic happened and everyone's like, oh, telemedicine, this is great.
Yeah.
We
Let's
should do
listen
this.
to who was that crazy dude, who was telling us this stuff before? Where is that guy now? So yeah.
Yes. So
Okay.
frustrating, but amazing that we've come so far in light of a tragic situation.
Now, Mike, you've really gone down the path of trying to understand, these things you're talking about, the quadruple aim, including it's great to have all these other parts of the aim, but if you don't have physicians that can actually manage and live their life and have a reasonable life, you're not gonna get anywhere. And in fact, it's another one of those things, like we talked about physician burnout. It's sort of like the thing about the physicians, not being into technology. Well, they're not burning out. It's that they're being put in an unreasonable situation that, it's not that they're burning out. It's just they're not put in a good spot. So Doc Health, sort of came out of that. What was your kind of process beyond kind of the, tiger text and trying to improve things for the physician? Where'd you go? How'd you get to Doc?
Yeah, I guess come on a journey with me. So, my clinical experience, I was about half-time clinical, half-time innovation and technology at Boston Children's. And, despite being only half-time clinical, I was just so frustrated by the amount of administrative tasks that I had to do as part of clinical care. And And as a physician, your mandate and your interest and your oath is to take care of patients. And what ultimately you were taking care of was paperwork and things that are easily lost. And so I'm unfortunately not the most organized person or the most structured, but I care deeply. And the challenge for me, and frankly the burnout, the moral injury that people talk about, was that I had all these things that I knew had to get done for patients, and I had no idea where they were in flight. I had no idea who was responsible for them, and I was never sure if it was actually done. Like, no one ever hands you back a piece of paper or a Post-it note that says, "Hey, I did that thing you asked me to
Yeah.
do." Or, how often do you reply to an email that says, "Well, thanks for that message. I've actually completed the thing that you asked me to do in within this email." And so, just the systems that we work with, email, Post-it notes, scribbling on the back of a clinic note, those are the de facto tools of like task management in clinical care. And my observation, and certainly we've validated this with actual surveys, like every clinical encounter results in 3 to 4 tasks. Fill out this form, call back this patient, talk to the PCP, book them for a colonoscopy. Some of these things are orderable in the electronic health record, but most of
Yeah.
it is just stuff we have to do. It's like talk to the social worker about the letter you have to write for college. All these things that ultimately we don't have a system to manage. And so my frustration was like, how do I manage all this? How do I work with my team in a collaborative fashion? How do I make it easier to take good care of my patients? So this is where that sort of provider burnout comes in. And at the same time, I was using tools like Wunderlist with my wife to manage our shopping list. And
Yeah.
when she needed me to pick up bananas at Whole Foods, she put it on the list. And when I was at Whole Foods and I checked the box, I got the bananas, she got a notification that the bananas had been gotten. And that was magical. I was like,
Yeah.
we're on the same page, and it's really simple. We need this sort of thing in healthcare. And so we literally, I used Wunderlist as an MVP with my nurse and my admin. I said, can we just test out this concept? Can we
Yeah.
use a shared task list and see if we can get coordinated better? And can we actually get stuff done in a more reliable and efficient manner? And it was like magic. I mean, within a matter of days to weeks, we were like completing dozens, if not hundreds of tasks. And fortunately, I had the benefit of knowing the right people and being part of the innovation program at Children's and having the resources to build out like a HIPAA compliant version of task management. And so that was the inception. And then, if we've got time, happy to talk about where
Yeah.
we've gotten since.
Absolutely. No, we have time for that. So this was, I mean, I think Children's provides wonderful care, you and your colleagues, and we have experience there. And luckily, we live close by, so for us, we can walk over, bike over for 15 minutes. But for those that can't, it isn't that wonderful. And the innovation centers allowed you to actually go and put some of these things into practice. So how'd you go from doing kind of the innovation side of it to actually saying this needs to be actually its own company and really provide you really need
Yeah.
to provide the leadership for it on a more full-time basis?
Yeah, I mean, it's again one of those experiences that it's super clear when you're on the other side of it. As we're going, I was the clinical director of innovation at Boston Children's, so I saw lots of projects. I was part of many of them, and this was my like little baby, so to speak. This was my passion project, and again, we had the right resources with technology to build it out and to sort of build an MVP, right? Build a minimal viable product that we can test. And part of the benefit and value and wonderful place that Boston Children's is that we had a fertile test bed to say, okay, this is Mike's crazy idea. He's trying to solve his own problem. Is this problem apply to others? And will the solution help others? And so we were able to vet that and test it over a period of many months to frankly almost years. And it got to the point where it was getting better and better, where people started hearing about it and offering to pay us for the solution.
Yeah.
And so it got to a point where I was like, this is amazing. Like, how does this not exist in healthcare? And so part of the sort of evaluations that we do in the innovation program and whether it's startups coming in or spinning out products or services or startups, is there commercial applicability outside? Is there, something that's sustainable down the road? Is this a sustainable venture? And it got to the point where again, people were saying like, this is great. Nothing like this exists. And can we use it and pay you for it? And so, it really was around that time where I started thinking, is this the sort of thing that I'm going to, leap and join and really focus on this? And, it's really, Doc Health is like the embodiment of my clinical passion and my technology and entrepreneurial passions as well. And so it got to the point where there was enough sort of de-risking and validation that this was like something of importance and people, find it valuable. And then we ended up, speaking to some investors who ultimately August Capital and the amazing David Hornick, who is our investor, said, we're going to give you some money to, really put some gas on the stove on this project. And that was enough for me to be able to, leave my full-time role at Children's and just scale back to a part-time clinician and do this full-time and really bring the team with me, which has been amazing.
Great. So obviously, you're a key part of this as a sort of, initial user and test case and banana buyer and all those other sorts of things. What were the other sort of skill sets that you needed when you talk about building a team? Who's on the team? What are those key skills that you're putting together?
Yeah, I mean, this is, team is everything. And, it started off with my co-founder, Heather Romehilt, who is a user experience designer. And she and I noodled on the idea for many months before we arrived at like task management is like going to be the thing. And so design and medicine are an important sort of foundational element here. And our other co-founder, Nitin Gujral, was the lead engineer at the innovation program. And so we had the clinical use case, we had some great design, and then we had an engineer who was able to build it. And then the sort of fourth leg of the stool ultimately was once we had a great product that, clinicians validated and, technologically was quite functional, we needed an operational business mindset to come in and help us sort of take this idea and spin it out of the hospital, license the technology, raise money from venture capital. And so Jonathan White, who is our chief operating officer, fortunately came on pretty early on the process and was able to help us, really operationalize things, spin out the company, raise funds. And that's the sort of corpus that really was the founding group and ultimately helped us get to where we are now.
Now, Children's is a special place. It also means there's some uniqueness to it. So if you have something that's designed just, let's say, to work within Boston Children's Hospital, there's a relatively limited market because all the top hospitals also think, well, anything invented somewhere else isn't going to be for them. So you've already excluded that group. But that's not necessarily who you're focused on. Some of the problems that you described are more universal or more common. How do you think about going from sort of, what's within Boston Children's to something that's more broadly applicable, and what is in fact your kind of target market?
Yeah, I mean, it's a great point, and I think that's part of the sort of process that we go through as we help, vet ideas and see if there's sort of commercial opportunity. Is like, at least in our case, there was broad application here, and in fact, there's even much broader application than we had initially thought. But what we've basically built a shared task list for healthcare, and so without being specific to pediatric GI, we've really just provided a solution to help clinicians and administrators alike work together. And that is independent of whether you're a mental health provider or a dentist or a internist or a specialist. There's a need across the board. And what we've created is just a ubiquitous platform that allows people to create templates and processes for the things that are relevant to their practice. And so, if you think about it simply, we're, a shared task list that allows you to create tasks with patient context. You can create any number of tasks and subtasks with sort of bundles, what we call workflows. And this could be applicable to really, again, any domain. And that's what we're finding in the market now is like, we have dentists and psychologists and, pediatricians and oncologists using it, which is exciting. And then, frankly, there's this huge opportunity outside of the traditional healthcare world of providers, which is healthcare companies, and there are close to 800,000 of them out there in the world, in the US alone, that have a need to manage tasks with patient context. And so that's a whole nother sort of market opportunity that we're beginning to surface and explore. The task management concept is really alive and well outside of healthcare, and we're excited to be the sort of company that's laser focused in healthcare and bringing it to market.
I can see how the task management would work very well within an office, the types of tasks that you described. Is there also any kind of a collaboration that you do sort of across practices? In other words, is there some kind of network effect from using Doc? If I'm using it in my practice and you're using it in yours, we have a patient in common.
Yeah, absolutely. So what we're excited about is, first and foremost, let's get the team, within an organization organized, right? So let's get everyone talking, swimming in the same direction, using a uniform tool so that we're not scribbling notes to each other and passing them in the hallway. But beyond that, it's really easy to share tasks across organizations as well and invite guests into an organization or a set of tasks for a patient or a set of patients, so that organizations collaborate more effectively, independent of their electronic health record or their patient portals, what have you. So this is an area that we're actively exploring. We have the ability currently to have guests be invited, and we're seeing a lot of exciting use cases where a practice is working now with their virtual assistants, which has become quite the thing in the pandemic, or a billing company or pharmacy, or an imaging center. These are all sort of collaborations where we're now eliminating the fax machines. We're now moving tasks with patient context from one organization to the next, which is an exciting next step of where medicine needs to go.
And when you talk about all these 800,000 healthcare companies, obviously a lot of segments within that. Any particular area that are the earliest adopters or where there's the strongest use case?
Yeah, so for sure, what we're seeing is there are all these new models of care, right? In particular, using virtual telemedicine, et cetera, as the model. So, there are a number of organizations we're working with that are providing virtual care to a subset of users. And so, one example I'll give you is there's a startup in Boston that provides drug rehabilitation services to patients virtually. And they were challenged because they had all these tasks to manage for their clients or their customers. And they're not a traditional provider, so they don't have an electronic health record. And they were using Asana, which is a wonderful tool, publicly traded company. They were using Asana to manage their tasks. But turns out that there's all this PHI in those tasks. And they were spending an awful lot of time using number signs and money signs and asterisks and various symbols to try and basically mask the fact that this is a patient name. And It turned out to be a lot more work for them. And of course, there's security and financial risk there. And so they, replaced Asana with DocHealth, and they've loved it. And now we're working on some API integrations and making things more automated. So, I think that sort of new models of care and virtual care, and the sort of various companies that are in that space have really been the early adopters for us.
Now, there's always some pivots when you're getting going with a company, and especially I think during the year like we've just had, a lot of changes have been made. You've already alluded to a key one, of course, on telehealth. But any other changes that have come either in terms of accelerations or slowdowns of what you were planning, or changes of your own outlook?
Yeah, I mean, for sure. So we came out of Boston Children's Hospital. We know the enterprise and the sort of challenges and pitfalls there quite well. Having said that, I think the pandemic just made implementing new technology in the enterprises even harder. So what we've learned is, we're just seeing great traction and excitement in the more small to mid-sized practices right now. Clearly there's a need, and they're easier to pick off, so to speak, and work with. you can spend a year trying to embed your technology in an enterprise, and in 5 minutes we can have a practice stood up. We're now on the Athena marketplace, so that really caters to that segment of the market. So for us, we know full well that the enterprise is an opportunity, and we're excited to move in that direction. But we're going where the wind is, and for us, particularly in the pandemic and just the stage of our company, the small, medium-sized practices, we're learning a ton. We're providing a great service, and it's ultimately informing, our enterprise approach down the road.
So I'm sure that given that you're still doing clinical practice plus being a full-time startup CEO, that you don't have that much time for reading. It's just my guess. But any things you would point to, whether books or anything else that you recommend or that you wish you were reading?
Yeah, so I will preface this by saying I'm not a huge reader, but I do occasionally pick up something awesome. And, as you might imagine, the Checklist Manifesto by Atul Gawande is like on my desk and is the Bible, so to speak, for doc health, because that is very much the mantra that we follow. There is a new book that I am excited to read that I have not yet started. It's called Backable. And it is by, my God, why am I blanking on his name? Suneel Gupta, excuse me, I almost forgot his name. Suneel Gupta. And it is supported by or written with Carlye Adler. And Carlye Adler just happens to be my childhood best friend's older sister.
Nice.
So a couple of reasons why I think Suneel is just an awesome guy. I met him through David Hornick, who's our investor, and he's just a really impressive guy, and the Backable is a super relevant concept to being a startup CEO and raising money and getting people to get excited about what you're doing. So I'm looking forward to reading that.
Excellent. Well, I have been always asked because I'm interested and also looking for books to read myself. I have been reading some books that are recommended by my podcast guests, so I'll put that on my list as well. And
it just came out about a month ago, but that's great.
I hope everybody has on their checklist to get the vaccine if they haven't. So
yes, amen to that.
That's one thing. Well, Dr. Michael Docktor, co-founder and CEO of Doc Health. It has been a pleasure speaking with you today, and looking forward to keeping track of your progress.
Thank you, David. Greatly appreciate it, and good to see you.
You've been listening to the HealthBiz podcast with me, David Williams, president of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.